connected to us. Dr. Ariyarathna, you have 15 minutes.
It's pleasure. Good afternoon to all of you. And let me first apologize for not being able to be there in person, because today I am actually in a program in the Eastern Province in Batikyo. I will be very short because I am quite conscious of the time. We are, I think, running behind the schedule. So the topic that has been assigned to me is a long topic: public-private partnerships, the benefits and challenges of collaboration between public and private entities in injury prevention. But I thought I would look at it in a little bit broader way rather than just looking at private-public partnerships, because I think partnerships are necessary in a much more broader context in addressing injury prevention. So let me touch on now, of course, what are really partnerships? Partnerships, as we know, like a marriage, they are relationships, arrangements, and various organizational structures for furthering collaboration to achieve better health outcomes. And in the case of our deliberations here, we are looking at injury prevention or saving lives. So in that context, we can look at the entire spectrum of injury prevention, that is health promotion, primary prevention, secondary prevention, tertiary prevention, and also, of course, the palliative care. In this context, I refer to the main document, that is the ministry document, which is the multi-sectoral strategic action plan on injury prevention and management in Sri Lanka. In the strategic pillar 1 itself, or the strategic action area 1 itself, you have identified advocacy, partnership, and leadership. So that shows how much of an emphasis or importance is attributed to partnerships. When you look at it a little bit more closer to the strategic action area 1, there are many interventions proposed: national and subnational mechanisms for multi-sectoral action established and functioning, then establishment of community village level injury prevention working groups, then national and subnational mechanism for multi-sectoral actions established and functioning, then establishment of community village level injury prevention working groups. Now, I represent both the professional association, which is the apex medical body in Sri Lanka, the Sri Lanka Medical Association, and at the same time the grassroots non-governmental development organization, the Sarvodhaya movement. So I'll pick from few areas of my own experience and try to then answer the question: what are the benefits, what are the challenges of partnerships, and not just in private-public partnerships, because I am not a big fan of private-public partnerships in all areas related to health, because sometimes we ignore the other sectors which are important, which can make a difference. So one thing that I noticed even in the multi-sectoral strategic action plan on injury prevention and management in Sri Lanka is that it does not really identify who the partners are. So it's mainly the government sector and really not mentioning even the private sector. So I find it quite interesting to see how we can really engage other partners as well. So when you look at injury prevention, we have very important partners. They are communities and community-based organizations. Then we have the civil society organizations, which are sometimes also identified as non-governmental organizations or NGOs. Then we have faith-based organizations. You know, different religious organizations can play a very important role in injury prevention. Then the private sector, of course, and then academia. Then professional organizations like SLMA and also the other specialties can play a very important role. And not only the medical professional associations, but also other professional associations such as Institute of Engineers, Institute of Architects, because they can also have structural designs which will prevent injuries based on the current epidemiology of injuries or the patterns of injuries in Sri Lanka. The safety is everyone's concern. Then local government bodies are very important. I don't see that those being mentioned here in the plans, but I think they are very important. Then of course the ministries, the main government agencies. So within this context, I start with the community. So we as a grassroots organization, have been promoting, identifying what are the common health problems in the community and trying to really impart very practical knowledge. Now, this is one example of what we call a Sarvodhaya program, where we have identified key issues that have a big disease burden in the community. Malnutrition, NCDs, then also on disasters, and of course now injury prevention. So we can incorporate some of these very practical ideas, how to make your home safe, how to make your community safe, based on actually the reported pattern of injuries. Because I don't think we should always tailor-make the kind of information that is relevant to the community. Some risks that are encountered by one community in one geographic area may not be the same in other areas. But of course we have a generic pattern. We know some injuries are common, whether it is in the north, south or central province or wherever. But while giving those, we need to also look at what are the risks and what are the injury patterns specific to that kind of area, as well as to various professions, trades, and other settings like schools. And I think that's very important. So you make partnerships. Now, earlier I have listened to another presentation in the previous breakout sessions. They were like how other partners like Sri Lanka Lifesavers, how they were contributing. We have also partnered as civil society organizations with both other non-governmental organizations which are specializing in, say, drowning prevention and also first aid and things like that. So there is one such program where we were training first responders in the community lifesavers, and within a certain program covering 12 districts in Sri Lanka. And the results have been very encouraging. In those districts, we have been able to have these trained youth who can contribute to injury prevention as well as saving lives when an incident happens. But of course, we have to, the impact is measured from whether we are able to bring down the hospital admission for injuries. So we are in that phase now. In those areas, can we really see a pattern where such injuries, the reported injuries are coming down, the incidents. So we partner with, just not the non-governmental organizations, but Sri Lanka Police has a very good team for life saving. So partnerships are really tapping the expertise of different organizations. Then of course the disaster management center, particularly when it comes to drowning prevention. Then within the government agencies, we have specialized agencies for different types of situations where we need to engage. So we have to look at this developing partnerships. Who are the agencies in the government, who are the agencies in the private sector, who are the relevant agencies in the academia or specialities in different professional associations who are relevant. So it's not about calling everybody to a meeting and say that this outline, let's work together. No. I think that the results are really achieved only if you focus and really catch the best expertise of each organization. So then I like to shift to the SLMA partnerships. SLMA has an expert committee on prevention of road traffic crashes, headed by Professor Shramadana, who was the immediate past president of Sri Lanka Medical Association. And this is a model program. I think we have created a platform for road traffic accident prevention, which is very inclusive, which is led by, of course, the experts who are working in the expert committee, but we are involved in the Sri Lanka Transport Board, Sri Lanka Insurance, and also the police department. So it is very important that collaboration happens in equal footing, in equal platform. Then we look at also engaging the private sector as well. Now in this particular program, and I'm sure my colleagues who are in the expert committee of SLMA are here, and they partner with channeling the SLP, Mobitel, Rotary, which is a voluntary organization, then Save Sri Lanka and Lions as well. Then to answer directly and finish my presentation, what are the partnerships of, what are the benefits of partnerships? So we have a situation we are leveraging the diverse expertise is only possible sometimes with your partner. You can't have in-house expertise for everything. So we leverage this diverse expertise if we have partnerships. Then resource sharing has to happen. Resource sharing is when you are not having enough resources to do it yourself, but also there are not just financial resources, but there are technical resources. So you can have a bigger and a broader impact on this. And then, of course, by partnership, you can reach groups which are not generally reachable through normal programs. So when you partner with a non-governmental organization, a civil society organization, or a religious organization, it opens up a new constituency to which you can reach. That's another benefit. Then, of course, we have to innovate models. I think constantly in the health sector, in addressing health problems, we have to have innovation. So when you have partners working together, you can come up with new approaches, new models that can solve problems. Then finally, advocacy and awareness doesn't stop at one point. If you have partnerships, it disseminates, you can sustain the messages, it can be reminded. So partnerships bring in those key benefits in injury prevention. However, there are major challenges. As I have mentioned at the beginning, even this our report, our strategic action plan, does not specifically mention some of the important partners. So we still don't seem to have that culture of partnerships. It is the spirit of partnerships. It's sometimes we like to contain into one compartment, and we don't want to give up our control over certain things. But if you have to address some of the key public health priorities, you really need to have a culture of partnership, give and share. Then differing objectives and priorities, particularly in the public-private partnership. That's why I said that I'm personally a little bit cautious when it comes to so-called PPPs, because a private sector organization would also always be looking at profit, and that is fair enough. I mean, these private entities are shareholders, and they like to have a return for their investment. But here, the investment may not come directly in the form of money. Saving lives will also, of course, save a lot of money, but it will not carry a direct benefit to sometimes for those private sector organizations. So there can be an incompatibility of objectives. The resource imbalances. So sometimes when we partner, some organizations can only bring in small resources, some are very big. So there is an unequal power balance. We have to manage very carefully. Otherwise, what happens is the entire program can be then taken over by a certain party which will have some other ulterior motives. Then resource imbalances, the same. It is that's the resource imbalances. Then complex governance and coordination. Who controls? Who gets the credit? All these things happen. So in a partnership, you have to have a clear definition of roles and responsibilities. Then how do you sustain such partnerships in the long term? Maybe in my tenure as the Assembly President, I may start something, but it will not be sustained because the same commitment may not be there from the organization the following year. So you have to have a commitment that lasts long. I mean, we have demonstrated in SLMA, particularly when it comes to road traffic crashes prevention, we have that ongoing long-term commitment. Professor Shramadana and the team, and it was a dedicated team somehow sustained this for years and years. So that's a good example of partnerships where we sustain for long-term impact. Then risks and accountability. Who is accountable? If something goes wrong in a partnership, people will just try to wash their hands off and say, no, we were not responsible. That's not in the spirit of partnership. We have to face risks, we have to analyze risks and also be accountable. Finally, in most of these efforts, we generate knowledge, we generate new knowledge, we generate techniques. So who owns? So intellectual property, sometimes we write a paper and we publish. So sometimes if you are not understanding at the very beginning, this is how we manage the information, the knowledge that we generate, then there can be problems. So these are the challenges for partnerships, and I'll end here. These thoughts really capture the essence of the challenges and benefits of partnerships, and all our intention should be to have a shared vision, mutual respect. If it is there, we can address these challenges and clearly define roles and responsibilities amongst partners. So let's partner to save lives. Thank you.